I think this is the first year we might finish on time, because anything I have to say will be brief. Um, well, we've really tried today to take a look at the Affordable Care Act and some of the areas where it has or has not impacted as we would have liked to have seen, some of the provisions that, some of the groups that have been left out or may have not received the full benefits that were supposed to be provided by the Affordable Care Act. We looked at some of the benefits and how many communities and millions of people are benefiting, but we always said, as Dr. Smedley said, we always said at the time that we were writing it, at the time that we passed it, this would not be the be-all and end-all. Insurance would never be enough for our communities. We always needed more. And while the Affordable Care Act was a major landmark piece of legislation, it was really just a giant first step in what we needed to do. So we tried to take a look at that today. I think our keynote kind of focused us on, I hadn't really thought about it. The Virgin Islands is celebrating 100 years of being a part of the United States in 2017. I've been focusing on that. I wasn't looking at 2019. But he's kind of given us a target of changing 400 years of being sick and tired. And so I think we ought to galvanize around that call to action. Fredette talked about a state of emergency, and I remember when we tried to get a state of emergency for the Minority AIDS Initiative, we didn't quite get it. We got a declaration of a severe and ongoing crisis. But in our minds and in our hearts, it was a state of emergency. And I think if we accept that we are in a state of emergency that has to be fixed by 2019, we'll get it done. But it has to come from us, as she said. We're going to have some help to do that. We heard about the Helen Health, help me out. Health Equity Leadership and Exchange Network, providing us not only information, but a way for us to remain connected, not only on the information side, but on the action side, looking at how we can shape policy and how we can reach out to our communities to utilize some of the programs that we know can work to get us to where we want to be in 2019. So remember that there was an open invitation. Bambi asked about the advocacy and our political activities, and I think, you know, that's probably where we need to really pay a lot of attention. We heard a question about doctors needing help. For example, we've introduced over and over again amendments to have the physicians' electronic health records paid up front. Didn't get passed. We introduced the community health workers into the Affordable Care Act. It's probably not funded at the level that it needs to be, and we're having other problems in offices of minority health not being funded, and we heard about some of the other the problems our providers are having. We heard about grants not going to African American entities. So there's a lot of advocacy that needs to take place, and it can't just take place from the Congressional Black, Hispanic, and Asian Caucus. It has to take place out where you are, with your representatives. So, and it all ends up, we're in a voting year. We're in an election year. And I just want to spend a little time on that because it's not a presidential election year. And if you ask people in your communities, you'll probably find out that many are not focused on it. Some people will say, really, there's an election this year? So if we want things to change, if we want our president's last 2 years to be years that are going to be productive for us, one of the things that we have to do is we talk and think about being really strong advocates and politically active is to get out there and make sure that everybody in our communities is registered to vote and that they vote in all of the elections, local, state, and federal. and that they vote on their interests. It's going to be a lot of confusion out there, so we really need you to help us get the folks out to vote if we're going to get anything done in President Obama's next 2 years. I wanted to just say also that, you know, we do a lot of things up on the Hill, and I'm glad that Shirley was still here. But in terms of not having that strong advocacy on the congressional side, we've been talking about health empowerment zones for many years. We had our health equity bills for many years before that. So some of the things that we can't do can be done at the state level, as Maryland has done. And Shirley's led the way. She had a health equity bill long before the Affordable Care Act came in. They have 5 health empowerment zones in Maryland. So everything doesn't have to be done at the federal level. If there's a good idea that emerges out of these discussions, try to do it on a local or a state level, where it's a lot easier. The federal government will come along eventually kicking and screaming, so just start it where it is. I just want to say thank you to a lot of different people. This is the last spring Braintrust. Of course, we'll have our fall Braintrust in September, but this is the last spring. And I don't know if Gary's in the room, but I want to thank the National Minority Quality Forum for being our strong partners over these 8 years. I want to thank my staff. Is Dr. Britt still here? I think Shanna's here. If anybody else in my staff is here, just stand up. Because you know, the programs that you've had over the last couple of years have really been put together by Dr. Britt Weinstock, so she really deserves the applause. And I'll thank AJ and someone that you probably don't remember, Leonard, who was here before AJ, for working with us with the Health Brain Trust. Of course, to thank my colleagues, many of whom could not join us today. Yesterday, they were just coming in. So at the time we were finishing, they were just coming into town, and today they were right at work, and so they couldn't be here. Some of them will probably join us this evening. I want to thank all of the community and advocacy and health professional organizations, all of the organizations that have worked with us over the years, because whatever we have been able to do, the health equity bills that we've introduced over the several Congresses, the work we did in the Affordable Care Act, we did them with you. And we couldn't have been successful without your support. I mean, every once in a while you get a blast email saying, please call up and this is gonna happen, help us out. We can't, you know, call your representative, call your senator. And it's really been helpful. I remember we started out the Minority AIDS Initiative with, I think it was $158 million. And I think it was in the next couple of years, we were trying to increase it, and we were getting a lot of pushback. But all of the AIDS advocacy organizations started putting pressure, and we got the money raised up to about $250 in the second year and continue to go from there. So just goes to show how much power there is out across this country when communities come together and organize and really advocate, because we didn't do it. It's those AIDS advocacy organizations that got that money increased. I want to thank all of the state and local leaders who've been working with us, like Delegate Shirley Nathan Pulliam. It's an important partnership for us. If the Congress passes legislation that creates a program or funding, it goes to the state, and sometimes you have a governor that wants to just use it how they want to use it. We need to be always working with our state legislators and our mayors to make sure that that funding goes where it needs to go. So I want to thank them for their partnership over the years. And all of the, you know, we used to call them sponsors, but, you know, let me thank all of the partners, all the private industry partners that have worked with us, supported the foundation, and allowed the foundation to support us. So with that, you know that this is my last year, but it will not be the end of my advocacy on health disparities and health equity. So expect to see me around one place or another for a long, long time. I've enjoyed working with everyone over the years, and I look forward to continuing to do that. Thank you all for being here. Thank you for staying for the entire program, and we'll see some of you this evening.